The new COVID variant Omicron has many more mutations than the Delta variant, according to a first image of this new variant initially detected in South Africa, produced and published by the prestigious Bambino Gesù Hospital in Rome. On the three-dimensional image, which looks like a map, we can clearly see that the Omicron variant presents many more mutations than the Delta variant, concentrated above all in one area of the protein that interacts with human cells, the team of researchers said in a statement Sunday. While scientists and experts are still working to find answers to many unanswered questions surrounding the new Omicron COVID variant, some doctors in South Africa, who have treated cases, said the symptoms appear to differ from what many have come to expect with the Delta variant. Raises global concerns due to its increased risk of reinfection. Scientists and doctors are working to collect data around how and why this variant behaves differently than others. So what are the symptoms of the new Omicron COVID variant? COVID symptoms linked to the Omicron variant have been described as extremely mild by doctors in South Africa who first raised the alarm over the new strain. Most of the new cases in South Africa have been among people in their 20s and 30s, and doctors note that age group generally has milder symptoms of COVID-19 in any case. They warn though that older people infected by the new variant could have more severe symptoms. We've seen a sharp increase in cases for the past 10 days. So far they have mostly been very mild cases, with patients having flu-like symptoms, dry coughs, fever, night sweats, a lot of body pains, said Dr. Unben Pillay, a general practitioner in Gauteng province where 81% of the new cases have been reported. Dr. Angelique Kutsi, chair of the South African Medical Association, told the BBC on Sunday that she started to see patients around November 18 presenting with unusual symptoms that differed slightly to those associated with the Delta variant, which is the most virulent strain of the virus to date and globally dominant. Kutsi said she tested the male patient for COVID, and he was positive, as was his family, and then said she saw more patients that day presenting with the same kinds of symptoms that differed from the Delta variant. Other patients she had seen so far with the Omicron variant had also experienced what she described as extremely mild symptoms, and she added that her colleagues had noted similar cases. What we are seeing clinically in South Africa, and remember I am at the epicenter of this where I'm practicing, is extremely mild. For us, these are mild cases. We haven't admitted anyone. I've spoken to other colleagues of mine, and they give the same picture. If the Omicron COVID variant has mild symptoms, why is it a variant of concern? WHO Health Emergencies Program COVID-19 technical lead Dr. Maria van Kerkhove said early evidence on Omicron shows that the variant has a large number of mutations, some of which have concerning characteristics, including an increased risk of reinfection compared to other highly transmissible variants. That means people who contracted COVID and recovered could be more subject to catching it again with this variant. What's the difference between variant of interest vs. variant of concern? Variants are categorized into three categories: 1. Variants of interest, 2. Variants of concern, and 3. Variants of high consequence. A variant of concern is one in which there is evidence of an increase in transmissibility, more severe disease, e.g., increased hospitalizations or deaths, significant reduction in neutralization by antibodies generated during previous infection or vaccination, reduced effectiveness of treatments or vaccines, or diagnostic detection failures, according to the CDC. The newest form included more than 50 mutations, which Professor Bennett described as strange, when compared to the handful of large changes seen in prior variations. Because the spike area is where the virus binds to human cells and where vaccinations are focused, mutations in this region are particularly important. Even if a person has been vaccinated or has had COVID previously, if the variety is sufficiently different from past forms of the virus, our immune system may fail to recognize it or remember how to fight it.